For those that are just joining us for the first time today, welcome. For those that are returning, welcome back. Just a bit of information. All of the past webinars are available on our website. That includes the slides as well as the videos. And for those that might either have to jump off to take care of a child or sign off a little early, the slides will be up on our website, I would say within the week, and the video recording of the webinar should also be up, I would say within like 1 to 2 weeks. Because we do have a large number of participants, which we're so happy to see, we are asking that people use the chat feature to type in any questions, comments, concerns. Each week, we also choose the topic based on your feedback. So if there is an area that you are struggling with at home, or if you are a professional and you feel like there is an area where a lot of the families you're working with are really struggling, or there are not resources, please let us know, and maybe that will be our next webinar for the following week. So each week we are creating these webinars based on your feedback. We recognize there are a lot of resources out there, which we'll also be sharing with you. So we really want this to be a useful 45 minutes of your time. So with that being said, today we're going to talk about life in quarantine with a severely affected individual. So what we've gotten feedback on is that there are lots of resources out there regarding social stories and visual strategies, but the idea is that for individuals who have intellectual disability along with autism spectrum disorders, or who might be nonverbal, or who have limited receptive language, a lot of these strategies aren't useful or not as helpful. So today, myself, Dr. Trellis, and Beth Brown are going to be sharing some resources. So just to do an introduction, my name is Michelle Gorenstein. I am a clinical psychologist and director of outreach for the Seaver Autism Center.
Hi, I am Pilar Treyes. I'm a child psychiatrist, also a physician at the Seaver Autism Center, and one of the co-directors of the Developmental Disability Clinic at Mount Sinai West. Beth? I know Beth is here with us, but we can't hear you. I will introduce Beth so we can move forward. Maybe she will be able to figure out her audio. Beth is a senior social worker at the Developmental Disability Clinic at Mount Sinai Hospital.
Okay. So just the format today, I'm going to talk a little bit about behavior as a form of communication. For those that have joined us in the past, some of this might be a review. We're also going to talk about safety and proactive strategies for people to be using. And then we're going to hear about the role of medication, and potentially when families who might be trying some of these behavior interventions and they're not working should be reaching out to find out if a medication might be appropriate. And last, Beth Brown has compiled a wonderful resource list. Everybody. I'm also going to ask if everybody can just mute themselves. Thank you. So when we think of behavior, all behavior is often a form of communications. So behaviors can serve a function and or produce an outcome. So a behavior might be to obtain a desired outcome. So example, for a child who might be engaging in tantrum behavior whenever there's schoolwork, the desired outcome might be avoidance. So they might want to not do schoolwork, and maybe they've learned that if they have a tantrum, then their schoolwork goes away. It can be also to get a desired item. So they might have learned that when they have calm hands, they get a reinforcer like a high five or a tangible reinforcer like an M&M. It might be to escape a task or situation. It might be to get attention, and often we like to think about getting positive attention, but for some kids, behavior might be a way to get negative attention. And for a lot of kids that we see, any attention is better than no attention. So often we'll see kids acting out because they want any form of attention. Sometimes behavior might be an attempt to self-regulate. So for a child who's engaging in self-injurious behavior or rolling on the floor, they might be looking for sensory input. It could also be sensory avoidance. So maybe they are in a loud room and they're banging on their head because they don't know how to communicate, it's too noisy. So it could be kind of trying to get out of a sensory experience. And we also see behavior as an attempt to gain control over a situation. And the reason that we want you to think about kind of what the behavior is serving is because depending on what function the behavior is, impacts how we are going to address it. So when we're thinking about behaviors at home, and again, we're not expecting parents to become ABA therapists, nor should you at this point, given all the other hats that everybody is wearing. We want to think about being a detective. So this is from Autism Speaks. These are questions that we can ask ourselves in order to try to understand what function the behavior is serving and give us insight as to kind of how we can address the behavior at home. So thinking about, did this behavior start suddenly? So for a child who was toileting totally independently, once COVID-19 and kind of social distancing and kind of everything happening, did they all of a sudden start having accidents? Could it be related to the lack of structure? Could it be related to anxiety? But thinking about, when did the behavior start? Also thinking about, is there an underlying medical concern or condition that is making him or her reactive? So when I get a referral for a child who all of a sudden starts like head banging, my first thing is for them to consult their doctor to make sure that there's not an ear infection, that the child is not trying to communicate a medical issue or pain. What is my child attempting to gain from this behavior? What is he or she trying to tell me? Does it happen in certain places with specific people or in specific conditions? Is it only happening when your child is trying to do Zoom with a specific therapist? Is it happening in a certain room in your household, or while their siblings are also doing their schoolwork and it might just be a little too noisy? What happens before this behavior? So when this started with my children at home, I noticed a significant increase in negative behaviors around 11:30. And it took me a little while of being a detective to realize, at school they get snack at 10:30, and I was kind of omitting that. And my kids were actually just really hungry. And by kind of thinking about their schedule at school and giving them a snack, I then kind of decreased those negative behaviors. What happens after the behavior occurs? So if they are having a tantrum, are they getting reinforcement, and are you removing them from the situation that they're trying to avoid? Are they getting more attention? So these are things that we want to keep in mind when we're thinking about these behaviors. And then what do I typically do to get my child to stop engaging in a behavior? So obviously, all of us are stressed. A lot of us are also trying to work from home. So we need to think about kind of some of the patterns that we might be forming. So if our child is engaging in negative behavior, and every time then we just give them their iPad to kind of quiet them and so we can work, they might start engaging in that behavior to get the iPad. So just kind of keeping those things in mind. So these are some slides that I borrowed from our chief psychologist, Dr. Paige Seiper. So when we're thinking about behavior management, we're thinking about those questions. And we're thinking about what strategies can prevent challenging behaviors, and also kind of thinking about being proactive, as well as managing problematic behaviors. And what we know is both positive and negative reinforcement increase the likelihood that a specific behavior will occur. So just some kind of very quick suggestions. When we're thinking about task completion, it is very effective to offer choices. So if you're struggling to get your child to do the 4 tasks that they need to do for the day, we might not be able to offer them choices about which tasks they do, but we can give them choices about what tasks they're doing first. It's also very helpful to give 2 or 3 choices rather than limited open-ended options. So for snack today, we have pretzels, we have apples, or we have goldfish. You can pick which one you'd like. Asking which of 2 undesired tasks a person wants to engage with often does increase compliance. So if they need to do their speech and they need to do a sorting, saying, okay, which do you want to do first, can sometimes increase compliance. Also use planned ignoring, increase attention to unwanted behavior. So we did mention that sometimes even negative attention can lead to increases in that behavior. So we want to kind of be very aware of when we are giving attention. I will say the exception is if there are safety issues. So for head banging, if a child is engaging in really unsafe behaviors, that is not a time to do planned ignoring. But if a child is engaging in a negative behavior that might just be disruptive but is not unsafe, thinking about ignoring those behaviors and then giving the attention when the child is engaging in either on-task behaviors or more expected behaviors. We also do see an extinction burst. So what that means is if this is going to be a new strategy that you're trying, and let's say your child screams, and you're going to try to start ignoring when they're screaming and only engaging when they're using an appropriate volume, you might see an increase in the behavior, kind of thinking about it as like testing the limits a little bit, before you see the behavior decrease. So that is somewhat expected. And we do encourage families, if they are doing this strategy, to kind of see it through. So expect to see an increase in the behaviors, continue to ignore the specific behavior that you're ignoring, with the goal of it decreasing over time. I will say people should be consulting with their child's teachers, counselors, speech therapists, ABA providers, to find out what strategies they've been using in their school, day program, and kind of helping you implement those strategies at home, because it can feel very overwhelming. So also adapting the environment, which we've talked a lot about. So I'm going to just mention it. If you want more information, you can visit our previous webinars. But organizing and providing structure, preparing for transitions and changes through the use of timers, visual schedules, using visual supports such as if-then boards, and removing or minimizing kind of upsetting stimuli. So these are just some visuals, and thinking about today's talk and thinking about individuals who might not have well-developed expressive or receptive language. These are some just very basic ones. So using a first then board. So just keeping it very simple with 2 pictures, where it's first this, then this. This would be used for somebody where a larger schedule might be overwhelming. Kind of thinking of some visual supports to kind of reinforce what is expected of them. So at my desk, I am sitting, working quiet. Again, what I do encourage families to do is reach out to copy some of the visuals that they may have been using in school. Token boards. So this is where you could use pennies, you could use the child's preferred character, and they would be earning those things for something. And it could be something tangible like Cheerios or a snack, or it could be an activity. And again, the frequency and how often this happens would be based on your child's behavior as well as their age and cognitive abilities. And this would just be an example of a visual schedule that could be created at home to help a child. One thing when we're thinking about individuals who might have significant behaviors or self-injurious behaviors or severe aggression during this time is really being proactive, creating a safe space. A lot of this is from Autism New Jersey. They have an article, Managing Severe Challenging Behavior in the Home. So before there are crises, families should have a safety plan. So thinking about if there are other small children in the home or elderly individuals living with you, where should they be going to stay safe if a child is having a severe outburst. Part of the safety plan should be that there are 2 family members present so that they can support each other. Also creating a safe space in your home. So having an area in the home where there are pillows or couch cushions, quiet, safe things for an individual who might be dysregulated to be in. That being also said, this might not be related to aggression, but making home modifications. So if possible, removing things around the house that could easily break, putting furniture in front of windows, making sharp edges dull, so putting tape on corners of tables. But the one caveat is not to make too many changes to the home environment, because I think what's causing a lot of individuals in the spectrum distress right now is all the changes. So obviously we wouldn't want to start rearranging furniture in every room, but it is wise to think about where your child is spending most of their time and making sure that that space is as safe as it can be should the child become dysregulated. Also, as caregivers, being mindful of our clothing and accessories. So if our child is someone that likes to pull on things, making sure that we're not wearing dangling earrings or necklaces and that our hair is pulled back could be helpful strategies. Proactive strategies, thinking about reinforcers. So things have gotten a little bit better, but obviously there are delays in shipping items through Amazon or grocery stores. So if your child has a very specific reinforcer, now is a good time to just stock up on that and making sure that that is not a reason for your child to have a significant tantrum. Thinking about what works for your child in his or her school or day program. What does your child enjoy? During this time, you might consider, if your child is really struggling, increasing the frequency of those reinforcers. So if at school they were on every hour or every 30 minutes, you can kind of shorten those periods of time and provide more frequent kind of positive reinforcement. Now is also not the time to start working on adding stress in your life. So while there might be goals or things that you were really hoping the school worked on this year, if it's causing significant stress and significant behaviors, my word of wisdom would be to kind of let those things go. We want to make sure everybody is safe. And if adding additional stressor is creating more behaviors and creating an unsafe home environment, give yourself kind of a little bit of break. I was on a webinar 2 weeks ago for professionals, and one of the speakers kind of said, right now is the time to survive and not thrive. While I hope we all can thrive a little bit, I think we do sometimes need to go back into survival mode. So it's okay if your child needs to be on their iPad a little bit more or engage in a restricted interest if they need to. Okay, so now we're going to hear about the role of medications.
Hi, everyone. I hope you can hear me well. So I'm not going to go deeply into the role of medicines, but I do want, could you go previous slide, please?
previous slide.
Yeah. But I do want to kind of present what is the role of them. And then if you find this helpful and would like to hear more about specific medications and the role they can have in the treatment of associated symptoms, we would be happy to have another webinar on it. I am using autism as an example, although we've been focusing on autism spectrum disorder. I know many of the families that have been joining might not have a child with necessarily meets strict criteria for autism, but they might have a neurodevelopmental disorder that requires support and presents behavioral symptoms. So just as we know, we define many of these conditions behaviorally. And we talk, just in autism, we talk about, deficits in social communication and repetitive and restrictive behaviors. Can you go to the next slide? And the reason I'm mentioning this is that generally when we treat these conditions, the cornerstone of treatment really still is today behavioral interventions, and much of what you've been learning with Michelle and Jesse before, and many of the things that Michelle has been mentioning today. But medications do have a role and can help with certain symptoms. And we don't treat necessarily the underlying condition with medications. We're not going to make a child necessarily more social. But we can treat some of the associated symptoms that can present either as a consequence of their difficulties. So for example, if a child has severe difficulties communicating and that's making him very frustrated, and that creates irritability and aggression, a medication might have a role to help if behavioral interventions have failed. In the same sense, if they have a lot of sensory symptoms and that is creating some self-injurious behaviors like, let's say, tapping, or that creates a lot of anxiety, medications might have a role in helping. Some of the things that we often treat with medicine are sleep issues, for which we have a lot of options, and many of these children do have a lot of trouble falling asleep, especially at this time. I've been hearing from a lot of my patients that sleep schedules have been completely off. And then attention issues or ADHD symptoms generally also respond well to medicine. Michelle, could you go to the next slide? So without going again into specific medications, I just want you to kind of think about some of the symptoms that your children have and which are the things, or when would we think, let's talk to the pediatrician, or if you have a child psychiatrist, maybe this is something that is not working, or your neurologist or developmental pediatrician. So I think as a rule of thumb, when the associated symptoms or the symptoms are causing significant impairment to their baseline, or where your child can work. So definitely that's something that would lead us to think of medications. Obviously, of course, when you have a symptom that we know responds well to medicine. So let's say you have a child whose sleep is very dysregulated and you've tried all sorts of interventions, and seems behavioral and schedules, things really don't seem to help, and the kid continues to wake up, or the adult, in the middle of the night, or wake up very early, or fall asleep really late, or take a very long time, medications can help with that. And that can be a huge improvement, not only for the individual's quality of life, but for the whole family at large. Attention, for example, is also a symptom that can respond to medications well. So it's about the specific symptom that you want to treat, but also how much impairing functioning of everyday life. Obviously, as I mentioned, when behavioral interventions have failed, definitely we should think of medications when we start to see behaviors that can be risky for other people and for the child, when kids are doing very impulsive things, or where they are becoming, the irritability goes beyond just irritability, it's going to aggression and physical aggression, for example, to self and to other people. These are times where maybe we need to think of medicine. And these are conversations that I always have with my patients, where we kind of put things into perspective. Medications are not a magical pill, as I'm sure you know, they're not a magical solution. They can help. And it's sometimes things like something else that you can add, like you have your group of interventions of supportive therapies, and sometimes medication is just one more thing that can help. And sometimes we are in situations like the ones we are living where life is just very off, where kids do not have the therapies they used to have, where, we are all a little bit more stressed. And, children just in general absorb a lot of this, but kids that have, severe neurodevelopmental issues, I see them as little sponges. They absorb everything, and sometimes they do not have the coping strategies or ways to express it. So sometimes we need to give them extra resources, and it could be that you decide to start a medication for the time being because you cannot access some of the other therapies and interventions you're having. And that has to be a conversation, and then just that balance of treating versus not treating. What are the benefits of treating this with a medicine, and what might be some of the side effects? And really what we want, as always with any interventions, is to improve the quality of life of the individual, but also of the whole family, especially in a situation like this where everyone is together, where siblings are at home, where parents are tired. We just want to make sure that, it's you're an individual, but now you're also part of this like structure, this team, and everything you do for one person influences, affects everyone. So all of these different things are considerations that we take when we start a medication. And I think it's important that they're not perfect, but we have options. And that if there's anything that is concerning, it might be a good idea to reach out to some of your medical providers and see if there's anything that could be helped with in medicine. And that's everything. I again will not go on the specific medications, but if you would like to learn more about it, we would be happy to have a webinar on that as well.
Okay, thank you. Okay, Beth?
Hello?
Hi.
Can you hear me?
Yes, we can hear you.
Oh, wonderful. Okay. I apologize for some of the technical difficulties. I just wanted to start by acknowledging everyone who during this pandemic has had to be parent, teacher, OT, PT, speech therapist, recreation counselor, cook, housekeeper, and on and on. And I think most of you can relate to this cartoon. Next slide, please. Michelle or Pilar, do you want to speak to the?
Sure. So just when I was thinking about, Beth put together tons of wonderful resources related to autism, COVID, organizations in the tri-state area. These are, PAL actually created a PowerPoint with tons of very helpful resources, specifically for severely affected individuals, with limited language abilities, as well as the AFFIRM, the Supporting Individuals with Autism Through Uncertain Times. So these are two resources kind of that give some of the strategies that we talked about in a little more, with a little more information, specifically for the group of individuals and families that we're discussing.
Great. So if you are not already on the email list of the agencies listed in the next 4 slides, I encourage you to sign up as soon as possible. These agencies send out invites to online educational workshops, online support groups, and special events. They have huge lists of COVID-19 resources and regular updates on what is happening in the field of developmental disabilities. The first organization is Include. They have excellent online resources and workshops. They have special events. Some of you may know about the resource and camp fairs that they have yearly, and their educational advocacy services and helpline are wonderful. The second organization is Synergia and their Metropolitan Parent Center. They also have wonderful workshops and support groups. They offer many programs for children diagnosed with autism, such as the Autism Initiative, which is a social skills learning program through the arts. They have many adult service programs, respite and community habilitation. They also have programs to help with educational advocacy and housing assistance. So sign up and give them your email. Next, yeah. The third organization to sign up with is YAI. For those of you who may not be familiar, they are a very large organization that provides services to people with developmental disabilities from birth through geriatric years. Some of you know their schools, the Manhattan Star Academy and iHope, and their medical services at Premier Healthcare. They are presently offering their behavior management training group for parents called Project Grow online. That just started. And yesterday they had their autism conference online. They will also be having their yearly Central Park Challenge online this year on June 6th, which I have to see how that looks online. So look out for it. The next agency is OPWDD. And OPWDD is the executive agency in the state of New York that provides funding and services for people with intellectual disabilities and developmental disabilities. And in order to obtain in-home support services, behavior management support, social skills groups, vocational services, and more, you must obtain eligibility for your child. This is a very lengthy process, but it is well worth it. You should begin by calling the front door office in your borough, and they will walk you through the process. And also, due to COVID-19, they are now having the required orientation meeting online. Next slide, please.
Sorry.
Ooh, there we go. These are just some of my favorite educational sites that you may want to explore with your children. Next slide. And here are some counseling referral resources, free medical info line regarding any questions you have about COVID-19, and New York City resources for food, rental assistance, domestic violence, and more. Next slide, please. And finally, the good news is that there is a tremendous amount of support and programs available online for you and your children. Sign up to receive emails, look on these sites for additional COVID-19 resources. There are tons of them, and feel free to call me if you have any questions. Hang in there and stay safe. Thank you.
Thank you, Beth.
And next time I hope to have my picture on.
Well, thank you for those wonderful resources. So now what we're going to do is because we have a larger audience for those that have kind of been at some of our smaller webinars where we've kind of let people unmute themselves and kind of share, we are going to ask everybody to use the chat feature. So if you have questions related to anything that we discussed today or other general questions, it does seem like there is a request for our future webinar to address medication. So that is definitely something we will do. Someone also said, could we do a webinar on sensory diets?
Yeah.
Definitely. We can definitely bring in, again, that would not be our area of expertise, but we could definitely bring in OTs. I will also say, if you are typing in the group chat and you don't want people to see your name, you could just type it to the host or the co-host, and that otherwise everyone is seeing it, but it's okay. So we do have a question regarding keeping a child in one space. Definitely discuss ideas. You can too, and I think obviously it's very dependent on the child's age, the setup of your home, and that. What I have done in my home is I have created like a school room where we have all the materials, and I have beanbag chairs for like the reading corner. And I've tried to make it as much like my children's classrooms as possible. And that allows us to kind of take breaks around the house and do like more recreational activities or outdoor play when we're outside. But it's a cue that when we go into kind of their old playroom, which is now their school, that they have to be sitting. But for children that might move around more, there might need to be more sensory breaks, movement breaks. So maybe in between their sorting and their speech therapy, you put on their favorite song and do a march around the apartment or the house to just get them moving. Or you do 20 jumps where you count down. So those would be some strategies that I would have. Beth or Pilar, if you have any others.
No. No, I think I agree. I think there's a lot of it is kind of keeping structure and just predictability in what we want to do every day. I think it will be hard to keep a child in just one specific room at home, but maybe it can be done by creating schedules or breaking up the time that the kid needs to be in that room for a specific period of time. Yeah. So
I see another question. I'm going to throw it out to Pilar and Beth. How do you deal with behavior where the child is destructive, but doing it because he knows it is bugging you? So you've identified it's attention seeking.
yeah.
But it's hard to ignore.
Yeah. I mean, I think that's one of the biggest challenges that we have. Not the behavior it's hard to ignore. Also, when the behavior escalates to the point that it creates a risk for the child, or sometimes even some patients that when they're old, when you have a little kid, you can hold him, but if you have an older child, an adolescent, or an adult, the behaviors to try to get attention can become more dangerous and more difficult to control. So there's definitely a balance, because I agree there's things that we cannot ignore, and then by responding to them we create the risk of reinforcing them. Michelle, how do you approach this?
So, I mean, I can also just speak as a parent who is trying to manage working full-time from home while homeschooling. We've been kind of using a tapping out system at my household. So when I'm feeling stressed and I can't ignore it, I will leave and call my husband or another caregiver into the room to take over. And that kind of has been working for us. And that's something that you can discuss if there are other adults in the household, saying, I'm stressed right now too, and I can't ignore it because I'm tired and I'm exhausted by the end of the day, and I know we need to ignore it. So when this happens and I say I need your help, I need you to come in and kind of take over for me. The other strategy, and I see another person on the call said it, is kind of giving them an appropriate way
to engage. Yeah.
With that behavior. So for my kids, when this first started, there was a lot of running around the entire house as I was trying to work, which was very challenging. So the idea was that we talked about, like, if you want to run, you have to go outside. So it wasn't that you can't run. So if there is a specific behavior, you can try to think about, is there a more appropriate way to express that behavior that would not be as bothersome or create stress within the family system?
Yeah. I see another great question here, also with a difficult answer. So the question is, for teachers and therapists, and I guess this also applies to families. So how do you deal when the primary caregiver is also experiencing either some anxiety or health issues, or even like frustration, which can obviously be aggravated by anxiety of everything that's going on, and that impairs their ability to help other children, to help their own children. So I think that it's very important, if we identify anything like that, even within our household, that one of the adults that is a primary caregiver is truly struggling, and that is affecting the child, or we are a professional working with a family and we identify that, I think it would be important to have kind of a separate conversation with the family and very gently suggest and acknowledge that this is a very, very difficult time. I think that it, to an extent, is normal and expected. I see it with myself and my kids. I also get frustrated, with teaching, and there are all of these memes that are very funny of like teachers laughing because parents are getting so frustrated trying to teach their children, and they're like, "Oh, now you get me." So obviously this is something that is happening all around. I think so. I guess identifying if this is just typical, normal, and expected, and we're all going through it, and if it goes a step further, if the child requires more support, probably just working with a parent one-on-one or with someone in your family and just trying to have that conversation in the most positive way, for the benefit of the child and the whole family.
And I will say Beth listed a bunch of really helpful resources if there was a parent really struggling. Unfortunately, there are not so many call-in numbers for individuals in the spectrum specifically, but there are free call-in numbers for caregivers, for individuals that are struggling with what's happening right now. So I would definitely encourage them to call one of those support lines. And I would also kind of help the family reshift their focus, that maybe there are things that they can let go. I know when we've had really bad days in my household, I've said, okay, we're going to take a break from school and work, and we're going to go on a walk, or we're going to just kind of play music really loud, and kind of giving ourselves that. Because I think if we say, okay, well, we have to get through school, and you have an OT Zoom session, but you're having a really bad day, like it's not going to help sometimes, and kind of knowing when everybody just needs a break is really helpful.
I think there's a couple of questions that you can probably group, Michelle, and they seem for you or Beth, if you can contribute. What do you do when you have a kid that seems to be stuck in a behavior that seems dangerous? How could you help them come out of it from a behavioral perspective first? How do you respond to it? Let's say if someone is headbanging and you try to ignore, but they continue to do it.
Beth, do you want to take it, or?
I think, I mean, obviously, yes, you do try to ignore the behavior initially, but in that process, you have to make sure that their environment around them is safe. I mean, that's the first part of it. Michelle, I don't know if where
I would
want to go with after.
I would also say kind of refocusing and reframing. So whenever they're not engaging in headbanging, or I know somebody said not requesting food, when they're doing something that is more expected, really providing a lot of praise will be helpful. I know someone mentioned initially that the headbanging is now potentially like a sensory issue. So then I would want to speak to the child's OT, or if they're in a day hab, the OT, to find out what sensory, kind of this goes to that sensory diet, what sensory strategies you might be using to get them that sensory input that they might be looking for in a more expected way and in a way that's not going to obviously harm themselves. So again, that's why, unfortunately, while we want this to be helpful, depending on the functioning of the behavior really impacts the intervention.
Yeah. Yeah.
I know also there was a question, and I know Pilar, you had made reference to it about kind of what to do if there's nothing that motivates him, individual, besides food. I think in an ideal world, we would say to move away from food, but that's really what's motivating you, and there's nothing motivating the child, and there's nothing else that's working. My gut would be to kind of stick with it, and kind of when things resume and the child is able to start working with the therapist again, to try to move away. I would also really talk to the individual's providers to find out what other reinforcers they were using in school or in the day program or within the therapies, to see if those are things that you could use at home. Also thinking about now would be the time that we could start using restricted interest. So if the child really is into the transit system, but you've always limited the number of videos that they watch of trains pulling into the train station, if that's going to be motivating for them and kind of you can do it into the day, that might be something to consider. But again, this is one of those things that if this has always been the case and food has always been the reinforcer, while we all agree that that's not ideal, while we're in this stressful situation, I would not be making that a focus of treatment.
Yeah, I mean, for also both of them, I want to just say something about medications. So one is that if you try a lot of behavioral interventions and, child is engaging in a behavior that is truly interfering and can be potentially harmful, that could potentially be a time to consider if a medication might help, maybe just for the time being until things kind of go back more to a more normal. And regarding the food, I have a number, unfortunately, many of medications that are used to treat some of the symptoms make kids very hungry. So they request for a lot of food. So just in particular, I'm just mentioning this because sometimes that might be the trigger. Just trying to figure out if it's the reinforcement that is being used and that's why the kid has it, or maybe he's taking a medication that just makes him hungry and he kind of constantly requests food. Or it could just be a repetitive kind of has taken a repetitive form or behavior. But it's difficult. I think what we are also trying to say, without knowing the specific situation of the child and the multiple things that are a part of that specific behavior, we're kind of just throwing darts and guessing different things that might be helpful for your family. But we hope that at least this gets you thinking and maybe bringing it to your providers and talking more about it. There was someone that was asking about ABA, and that's a very general question. I think that the easiest way to know what services will help your kid would be to request an evaluation either through the educational system or with professionals, some of the resources that any of the agencies that Beth shared about. And with a comprehensive evaluation, one of the recommendations would be if the kid is eligible or not for therapies, including ABA.
Someone just typed in a really good question: how to deal with inappropriate behaviors during pre-puberty stage. And I think this is something that we see a lot, and unfortunately, no matter individuals' cognitive ability, their physiological changes typically happen at the same point as their peers, while cognitively and socially they are not kind of at that point. So I guess one thing would be to be consistent with your messaging. So if one of the behaviors is like, let's say, touching themselves in public spaces, like the den or the kitchen, being very consistent in terms of where you dress or undress your child. So often we hear so many times like, oh, I just dress everybody in the common area because we have to, pre-COVID, we have to run to school and I'm getting to work and it's just so much easier. But in terms of messaging, that's slightly confusing to the child because you're now saying, okay, well, you could be naked in the den when I'm getting you dressed, but you can't be naked in the den at other points. So things like getting them dressed and undressed, if they're still needing assistance, you can still assist them, but it should be done in like the bathroom or in their room to teach them, okay, these are the places where it's okay to get naked or it's okay to touch yourself. Using visuals like red and green signs. So when you see a red sign, that means you can't touch yourself. When you see a green sign, that means you can touch yourself, and having a green sign in the bathroom with the door shut, and having a green sign in their bedroom. Obviously becomes a little trickier when they share a room with siblings. But again, kind of just very concrete using visuals. If you email Audrey or Barry, they can email me and I'm happy to send. There are tons of resources depending on your child's cognitive ability. There are great video games to teach boys like the social norms of using a urinal. So there are definitely a lot of resources out there to help individuals during that pre-puberty stage learn like the new social rules.
Yeah.
So I see somebody wrote a list of recommended anxiety medications. So it seems like maybe our next webinar, I don't want to speak.
Yes. Yeah, no, yeah, I was going to say that, yes, I think our next webinar should be on medications, and I would be happy to provide, lists and kind of talk more in depth about medicine and the role they might have and what might work and might not. And if also you can reach out to either Audrey or Barry who are there, and if you want to get in touch with me and they can give you, you can get in touch with me through them, but they can give you my email address.
So I think we have time for one more question. Someone asked about like a diet to help with hyperness.
Yeah.
Laura, do you want to just take that on, or do you want me to?
We're talking, I'm sorry, I'm just reading out the question.
I think
we're talking about like
free or like that kind of, those kind of diets.
I'm sorry, like gluten. We're talking about food diet.
I'm assuming that's what
Okay.
I read it.
Yeah. Yes.
Food diet.
There are also
Thank you for clarifying.
diets. I mean, there's a lot of controversy about diet and food in autism and just neurodevelopmental disabilities. My response always is that if you have a child that eats other things than bread and milk, and you can afford to try a gluten-free, casein-free diet, and you don't think it's going to be a huge impact on your family, you might be able to try it. And sometimes parents that I work with, they swear that their kids do significantly better, and they think the effort, it's measured up to what they see. And that I think is perfectly fine. Definitely a child is not going to be harm. And again, there's, I mean, the only harm might be to your wallet, but other than that, I think it is fine. There's many other children that parents try a gluten-free, casein-free diet, and they don't see a difference, or they just find it very difficult to keep up because their kids eat 5 things, including cookies, bread, and just taking them away just makes their life a lot harder. So I think, like with everything else, there's a balance. I think if you have a child, it hasn't been difficult to change the diet at home. You can keep with it, and you notice a difference in behavior. My response is like, it's why not? I do think that if you want to start it, and that's many people ask me, I kind of tell them the same. It's like, you know, what does your child eat? You know, just with the understanding that there's not a lot of evidence, and it's a lot anecdotal, and a lot of it comes from parents. But I truly believe that they see a difference. Parents are very objective, and they're very attuned to their children, and if they see a difference, I'm sure that for some kids it might have a benefit. So I don't know if I'm answering, but I hope it was helpful. I think in this particular question, it might be useful, so you can try it more strictly if that's feasible for your family.
Yeah, and the one thing I would just think about in terms of the timing, if that's going to be adding a lot more stress in terms of your food shopping or financially, kind of keeping that in mind when you are thinking about it.
Yeah. Those are the main considerations at the end.
Okay, well, on that note, thank you everybody for joining us.
Yes.
So tune in for next week when we will, or Pilar will be focusing more on the medications.
Yes.
And
then I will work on seeing if we can find someone to do the sensory diet. And if you have any other ideas, please reach out, and we'll try to do our best to bring that back to you.
Right. And I think, sorry, and I want to just answer this because I think the person had emailed a few times. Are there any names for test for ABA? So I can take this one. So when we make the recommendation for ABA therapy, we do that based on typically like a psychological or psychoeducational evaluation. So we look at their cognitive abilities, we're looking at their social skills, communication skills, behavior issues, and kind of that's what we use. Within ABA, there are assessments to assess progress, but so ABA is a intervention based on data. So if your child is in ABA, they are constantly collecting data on how many trials they're doing, how many times your child gives the appropriate response. It might be the time it takes for them to respond or to engage in a off-task behavior. And then they're creating interventions and kind of monitoring to confirm that the intervention is leading to the desired outcome. So when we recommend ABA, it's more based on the child's behavior, cognitive ability, and then there are assessments that ABA therapists use to monitor change and progress. And I will say for a lot of kids on the spectrum, ABA is recommended, but again, not for everybody. And that would be something where, as Pilar had mentioned, that you would get a comprehensive evaluation to assess whether that was the right treatment for your child.
Okay.
But I do also think that a future webinar that we are looking into is kind of how ABA providers can help currently and kind of what that would look like ABA remotely. So that is also something that we are in the works. But I think next week it sounds like there is a large request for the medication. So that'll be the next one.
Okay. Perfect.
Okay, so I'm going to stop sharing the screen. Thank you, everyone. I will I'll stay in the webinar. And if anyone has any other suggestions, feel free to type them in, and we're going to use all of your great ideas to create our upcoming topics.
Yep. Thank you, everyone.
Thank you.
Bye.
Bye-bye.